Okay, so welcome everyone to the State of School address for this year. I really appreciate your attendance, and we're going to do something a little unconventional, which is not unexpected. We're going to start off with John, who needs no introduction, but he's going to bring us up to where we are today and really that journey that we've taken. I'm going to pick it up from there and talk about the vision and where we're going for the future. So, John, all yours. Thank you.
Thanks, Cathy. I'm John Samet. I used to be dean. So I have to say, I want to start off, before we go on to the state of the school, I just have to pause for a moment and talk about the state of the world. And I think all of us have been so concerned about what is happening. And I can't sort of blithely trip into the state of the school without saying that this is perhaps one of the most troubling moments in history that I've experienced in a very long time. Some of us in the room grew up with the specter of Cold War and nuclear threats, and now we're sort of in a total moment of global destabilization. It's about public health. Think about what is happening, whether it's Ukraine, Gaza, and elsewhere, and there are so many places where this is going on that you're not even aware of. I've spent a lot of time in Ethiopia, where essentially there's multiple wars going on within the country at the moment with people starving. So I think just to put things in context, we face, I think, one of the most troubling public health problems right now, which is conflict and its consequences. So I just can't move on to the state of the school, which is far better than the state of the world, without making these comments. So with that, I want to go on and quickly trip through 15 years and talk about, if I can advance, talk about what has happened. I want to start with a quote from Maya Angelou, which many of you probably know. If you don't know where you've come from, you don't know where you're going. And I do think that's important. And looking back at the trajectory of our school, where we started, where we are now, and where the school will go with its new dean and the next dean and so on. So let's talk a little bit about where we've been. I'll start with the founder of the original Department of Preventive Medicine, a man named Jacques Cobb, who was very social-minded, very concerned about the nuclear complex and its implications for health. And as a couple of comments, he's related to my wife, Connie, probably some distant second cousin, if I have it right. Well, something. And I met him later in New Mexico, where he moved, and was very involved in work about the implications of that state's nuclear complex and nuclear industry. And I met him around the issue of underground uranium mining. Since then, 1965, a lot has happened. I think seminal years, 2007, 2008, when the Public Health Act of 2008 was passed. The school was part of the plans to develop and train the public health workforce of the state. So the school began. It had an important purpose and mission around the state. It was, of course, founded as a collaborative school, and I'm grateful to those who, beginning in about 2004, began to work through the details. And if you just imagine bringing three universities together with fiscal arrangements, academic arrangements, and I have to credit Dick Hammond and others who worked with him in creating this collaborative School of Public Health, which I think remains an asset and one that we can build on. We are accredited in 2010 by the CEF, the Council on Education and Public Health. We're right now, of course, in the midst of reaccreditation of the school for the second time. And over time, just some of the highlights of funding, programs developing that help us fulfill our mission for the state. I started in 2017. Actually, this month marks my 6th year with the Colorado School of Public Health. I started on October 15th, 2017 as dean. I didn't quite make it to 6 years. I don't know. So we'll see. I couldn't quite hang in, I guess, but it's been a wonderful 6 years. And I think since then, of course, we had the jolt of COVID, which I think, of course, made us deviate from strategic planning efforts and implementation that were in progress, but also I think galvanized us around our mission and our mission of doing things for the state. And I think there's going to be a lasting mark on the school from those efforts and stronger partnerships with state and local public health and other institutions. Cathy, of course, started August 1. I describe my life to people and I say, this is my 3rd month of not dean. I'm still sorting out what that is. I suspect it will be something that evolves over time. The school has grown. It's grown in numbers, and here's a look, and just, keep your eyes on the MPH, which, of course, constitutes the bulk of our students. And you can see the surge with the pandemic. This is the graduating students, that 2022 jump. And we're probably at about the right numbers. I mean, I think at some point, the school will have to decide what is the right number of students and what is our capacity. If we want more, why more, or less, why less, and who is it we want to train. And then our other degree programs shown to the right. Our faculty numbers, I only have Anschutz. As you know, University of Northern Colorado has a small core of students. At Colorado State, our model is different. There's a small core, and then a large number of faculty members, perhaps numbering around 70 or 80 now, who are affiliated with the school, whose primary appointments are in various schools and colleges around that campus. Our research has grown, and Cathy is Associate Dean for Research under her. Under her leadership, our National Institutes of Health funding rose, as have our other sources of funding. And I think appropriately for the school and given its mission, we have a broad foundation of support. Some of it coming from state public health, some of it coming from foundations, some of it coming from the National Institutes of Health. The program at CSU has also seen a growth of its funding. And I think if the two institutions are put together, as you know, we rank quite highly in terms of our total research portfolio. We're publishing a lot. And it seems if we look at the impact factor, the number of times that our papers are cited, we are being cited more and we are publishing more. Perhaps during COVID, people sat at home and wrote papers. I tried, but in any case, our publication rate has gone up, and our scholarship is meaningful. It's being cited. So I think that's really critical here. And then in these rankings, U.S. News and World Report, I know they're being sort of set aside by some, and there are these mysterious ways that these rankings are achieved. However it works, we have risen up in those rankings to being the top 20 for the last several years. We're at our 15th anniversary. Dick Hammond's picture is here as the person who got all this rolling. There's our 10th anniversary book that came out featuring a number of our faculty and students. So in closing, here is my calendar of 2,115 days as dean. Seems like only yesterday in reality that I arrived here. And then, of course, the new dean has survived all of 78 days. So we will see, Cathy, how many to go? So good luck with that. And I'm going to close just by a reminder of our mission and the vision. And if you read the vision statement, the Colorado School of Public Health will become one of the nation's premier institutions for public health education and research with top recognition, et cetera. I think we've done it. I think that has happened over 15 years. And my comment, my point to turn things over to Cathy is time for a grander vision. So Cathy, we look forward to your executing that. So please take over. Thanks.
Okay, going forward. So this part of the presentation, I'm going to talk to you about the next 5 years, years 15 through 20. When you think about this time of life, it is a high growth phase, a time of incredible change. As we go through this adolescent period into young adulthood, and we think about all the things that we did, how exciting it was at that time as we went through that growth period. And part of that was also doing some things that may have been a little crazy. You know, if we look back and really thought about it, we might not have done some of those things, or at least we would have done them differently. That's the period we're headed into. So really exciting time. As I go through sort of the vision and where we're going for the next 5 years, I've structured it in this way, where I'm going to transition from the internal, what we're doing as a school, introspection, right? And also the external, incorporating comments that I've gotten from many of you internally, but also that I've gathered up from other deans, other schools of public health, those that we want to aspire to, those that we're already alike, those who've gone through this period of 15 to 20 years of high growth and change and maturity, that have some clues for how we might approach it while staying true to the Colorado School of Public Health and what it is that makes us so incredibly unique. So before going into that, I want to take a few moments and thank John. Thank John for everything he has done for our school, which has been really, really incredible. And it's such an honor to transition. As I transition, there are some things that you may not know about John and I. We actually have a ton of things in common. Of course, the passion for public health, but what you may not know is that we grew up about 35 miles apart in this section of Virginia called Tidewater. He was on one side of the river and I'm on the other. And this is kind of a cool place to be. It's very pretty, big military influence, hard to be snobs coming from that area, right? Except about one thing, this little guy here, the Chesapeake Bay blue crab. It is the standard for what counts as a crab cake. And so John and I happened to be in an alumni event. Connie was there too. And they served crab cakes, put them out. And there was that moment, John and I looked at each other like, gonna eat that? You know, so that is something that is very unique. The other thing is avid cyclists. And this is a ride we try to do every year, Buffalo Bicycle Classic in Boulder. It raises scholarship money for students there. And this is Team John and Connie and me and Deb Ritzwaller. So this year, Deb and I rode 72 miles. We did that loop going up to Carter Lake. Beautiful view, got to look over it. But John wasn't there this year. And so we really, really missed you. We missed you too, Connie. And I picked up a t-shirt so that you would be able to see if I can get myself untangled here, everybody, for our ride. So I hope to see you next year. Okay. Hope to see you next year. I hope to see you many years there. Okay, let's talk about this high growth phase that we're about to enter into as we go forward. Staying true to our true north, which is all about excellence in public health research, education, and practice. Those are the 3 pillars of our institution and will remain so. And each has to remain strong, not getting out of balance at any time. Most new leaders start off with a listening tour And even though I'm the internal candidate coming in, I also did a listening tour and have continued to listen and to attend various groups and talk to individuals about the school. And one of the main questions I've had that I try to ask each time, what is it about us that made us rise so far, so fast? 15 years. We stood our school up, we went through tough times, and we have done incredible things. What is it about us that made us get there? Consistently across the board, every group, here's what's mentioned. The faculty research, internationally known, nationally ranked. What John showed was the remarkable growth that put our school into the top 20 of NIH this year. We're up to $47 million if you count the numbers the way Tom Flagg's group does, and 45 or 43 if we count it the way Michelle and I do, a little bit more conservatively. Public health practice and the positive relationships in the communities we serve being absolute critical to our success. The way we are viewed in the communities and what we do as a practice. Multi-campus model, John mentioned this as well. It's a unique model among schools of public health. Our demonstrated expertise and leadership during COVID. Unquestionably, this school provided evidence during a time of crisis. During a time of so much uncertainty, this school is at the forefront, leading our state. John speaking to the governor every week and providing answers and clarity. We're in Colorado. Everybody talks about all the beautiful mountains. They are special, no question. And we're the only accredited school in the Rocky Mountain region. And this last point, being a collegial team, that's critical too. It's part of who we are. It's part of our culture and something we want to maintain. So these are the things that helped get us to where we are, consistently mentioned, and they're the things we want to hold true to as we go forward. Now, as I started to talk about, okay, what are we doing? And going forward, even during the time at which I was interviewing, many people said to me, we don't know who we are. We don't know who we are as a school. What do people think of when they hear Colorado School of Public Health? What's that key identity that sets us apart? And I think it's fair to say we haven't figured it out just yet. And now is the time, as we go in this period of 15 to 20 years, to figure that out, this growth period. And of course, growth doesn't mean we're going to double our class size or bring in tons of new people. It could mean that, but it's also the growth of a mindset. I was in a meeting of our associate deans and campus leaders, and we're talking about, okay, how do we lay this groundwork for our upcoming strategic plan? How do we do everything? Ned Kalange, who turns out to be our school poet, sits up and thinks, you know what? We really are an undifferentiated stem cell. And so, okay, Ned, all right, that's an interesting way to characterize it. But in some ways, that's true. We have done a lot of things, haven't yet differentiated ourselves. And we could go in any number of directions. We have those opportunities. As we think about this high growth phase and amplifying our strengths and addressing some challenges, I also hear these consistent kind of challenges. We're not the only one who have these challenges. The sustainable funding model and getting alternative sources. That's the game in academic higher ed. It is certainly true of our school and being on this campus. And what's unique about us in particular here, we're the last one on this campus. So yes, we get the smaller percentage of the dollars, but in order to get more, somebody has to give money up. And surprisingly enough, they're not willing to do that right away, right? So we are looking for other ways of funding sources, of our stability, of being able to move forward. The generosity to our school is coming from tuition. We get tuition dollars, and that's a really important thing. We have to be incredibly smart about how we think about those tuition dollars and how we spend them so that we are then incentivized to make the most and to be really customer focused as we go forward, thinking about what's innovative, what's in demand, not to create one more certificate, but instead to think along those school-wide lines. And then our culture. We are very collegial, and that's an important thing we want to maintain. But we also have to think about us acting as an entire school, as a unified voice as we go forward. Our tendency has been, as we started out as a young school, to be very much thinking of entrepreneurial in and of our own research, but we have to think about it more broadly. Last week, I invited Dean Barbara Reimer here to visit us from the University of North Carolina. And what was so interesting about Barbara's talk and about the University of North Carolina, she was dean there for 17 years and oversaw an important period of their growth and development. She mentioned two important things. The University of North Carolina is the only school of public health that brings in more extramural dollars than their medical school. It is also the highest use of their tech transfer and the equivalent to CU innovations. They go out and they commercialize their products, their academic products, and get them commercialized and promoted throughout the country. So also interesting, we have to think about ways in which we're going to start to diversify our portfolios and how we then too move into this next phase that we want to be successful in. Elevating public health. Every school of public health deals with these three things, these three myths that are out there. First, public health isn't sexy, right? It's interesting about that one because we save more lives at less cost than it does to take a single molecule from a lab, if it ever gets out of the lab, into a drug of some sort. Public health is saving tons of lives. How can that not be sexy? But I get it. A friend of mine was the state epidemiologist in Virginia. She used to say that the tagline for Virginia Department of Health should be, "We take the fun out of life." So, which is very interesting. And if you think of some of the traditional roles of public health, where we're focused on make sure the eggs are all the way cooked, don't eat the lemons that's been laying out on the counter, you can think that way. But it's really exciting what we do and the changes that we make. Second myth, public health isn't a science. I always wish I could rename our school the School of Public Health Sciences. We are data-driven, evidence-based, and grounded in theory. We need to be able to say that all the time. It's not somebody making things up. It is data-driven, evidence-based, theory, grounded in theory. That is what we do. And the things that you have done in this room, you affected and changed the lives of millions of people by the things that you were able to create through your research and through the practice. We need to make sure that message is out there. And then this last one I'm guilty of too. Public health is invisible until it doesn't work. And that was said so much during COVID because lots of things fell down, not just public health, but public policy and communication, disinformation, all those things. Public health as itself didn't necessarily have a chance. But what we do need to do is make sure we're visible, that we point out all the many things that public health does as part of society's infrastructure that simply can't advance unless public health works. And we need to make that visible and make that known. So part of it is on us to be able to communicate a stronger message. So what's our purpose? Thinking both internally and externally. We solve consequential problems that matter. Reduce health inequities. That's a core part of our mission. Enhance the culture of innovation. Partner with our communities with a model of engaged scholarship. NED is working on academic health departments as being part of this. Expand research partners and multidisciplinary approaches. This is part of our innovation, our ways of looking beyond. Looking out into Colorado, these are the 5 causes of death. And I'd like to thank Sarah for putting this next set of slides together. Cardiovascular disease and cancer, that's what you'd see anywhere in the country, whether it's ranked 1 or 2. Accidents, lower respiratory diseases, and now COVID rising as number 5. If we stratify by Black Coloradans and Hispanic Coloradans, the first 3 remain the same. We see drug-induced deaths, drug-related overdose creeping into both of them. We know nationwide life expectancy is continuing to fall. despite the fact we spend more than any other nation on healthcare, and we do so by an order of magnitude. That these inequity gaps, not as only is it falling for everyone, but it's doing so at different rates. And they fall along different rates along racial and ethnic lines, along socioeconomic status. And then for those of you who have read the New York Times article, it also falls along the educational gap, such a big difference. Here in Colorado, some emerging problems, environment and air quality. Look at these statistics. Denver, Fort Collins, and Colorado Springs ranked 6th, 15th, and 20th for the worst U.S. cities in ozone pollution. We have other climate risk around rising temperatures, drought, and fires. Drug overdose deaths from any drug rose 85% in 5 years. 114% increase in overdoses due to opioids. And this last one, and we see this all throughout Denver, homelessness and housing challenges, 44% increase in Denver's homeless population in the past 5 years, and number of families homeless for the very first time increased by 120%. These are incredible problems that are right here in our community. They are all public health problems. For that reason, I made a commitment to make investments in climate change and health, and mental health and chronic disease over the next 5 years. Moving now to what it is we're going to do, getting internal. Vision without execution is hallucination. So we always have ideas about what it is we're going to go forward. We have to actually do it and have these tactics for what we're going to do. So starting with restructuring of the dean's office. As I talk to other schools of public health, again, who have grown to this stage, who are in this stage, and now they need to accommodate this growth, where there's some unevenness, some awkwardness across the school, and that it's maturing. Some positions that were key in these other schools are these two. So 2 new positions added, Michelle Kuba, sitting here up front, Assistant Dean for Operations, and Travis Laker, Assistant Dean for External Relations, also sitting up here. So pleased to have both of these individuals. Michelle is the nicest, kindest person, and the most organized, dedicated, on top of every single detail you could ever hope for. And then Travis, for those of you who haven't met Travis, he just started on Monday, and I can't believe there are people who haven't met Travis, right? So Travis has been in the university for 10 years in our advancement office, and he really is here to advance what it is we are doing in the school and to elevate it. Extremely outgoing, extremely well connected, such an asset to us. So these 2 positions, Michelle is really starting off to head up our strategic planning. She's put together a steering committee that will start to shape our identity. That's looking at that question. Okay, we're an undifferentiated stem cell. What do we want to be? And starting that exercise. We want broad input. You will all get questionnaires to be able to shape that. Also looking at our mission, vision, and values. John said at the end of his presentation, it's time for a grander vision, and it is. That's where we're at. We've achieved the things we set out to do. So we want to set a new mission and vision to reflect where we are and to reflect our values. And then as we have that going forward, everything we do should be able to tie back to those things, our mission, vision, and values. And our priorities, where are we going to start? Our nature is to do everything that we can because we're inclusive, right? But we know we can't do it all. We've got to start making some choices. Doesn't mean we love you less if you're not on that priority list, but it does mean that we're going to emphasize some things and have a strategic plan that we can implement in the next 5 years. Travis, community relationships, stronger financial position, to really help us with this diversification of our portfolio and to grow. Elevate the school and community, this engaged scholarship. The community, and we know that's broad, we have a presence around the world, but the community has to know who we are. And our relationships are part of the strengths of our school and how we have grown and done well. We need to do even more. And to think about growing our support, leveraging those relationships from a variety of sources. we have accomplished some things. We have a new endowed chair for the Center of Global Health from the generosity of Steve Berman's family and friends. Elaine has been such a terrific partner of the school. We are so privileged to have had that donation, and it will change the way the Center of Global Health operates on this campus and elevate what we're doing globally in a way that hasn't been done before. We have gotten commitments, even in this short amount of time, for more scholarship support, as being such a critical aspect of what we do as a school is to support our students. And then lastly, we're planning a founding funders dinner. I want to take a minute to talk about this and why I want to do it. The idea is I want to bring together the people who initially, and the organizations who initially invested in our school 15 years ago, who came together and said, this is something we need, and wrote those first checks. The reason I want to do this, first is to celebrate, right? We're pretty awesome. We need to celebrate everything we've done. And this is a chance to celebrate. Whenever you celebrate, you need to take a moment and thank those who helped you get there. And these folks helped us get here. They were part of the reason we exist. And this is a chance for us to celebrate with them for the foresight that they had and to thank them. Sure, I would absolutely love them to write big checks on the way out the door. But this is really all about buy-in to where we are and get their input onto our future and show them the distance that we've come. How incredibly important it is to celebrate along with them, to show that gratitude, to further develop that relationship and hear what it is they have to say about our future. So this is something that's very important for me going forward. On the immediate horizon, Danny is doing incredible work on our reaccreditation. She is helped tirelessly by Tony and all of you. I have been involved in this process. It certainly takes a village. She is also taking leadership on this curriculum redesign to match our priorities. This first slide, or an early slide, that was really all about being customer focused, not just one more certificate, but a coordinated set of educational offerings that meet the needs of our student population. We know that nationally enrollment in schools of public health is going down. We also know we're going down a little bit more. So that's something we want to get on top of, and now's the time to do it. And this is the way to do it, is to think about customer focused and what we need and coordinated. Our department chairs are working hard on a centralized budget model, so we align the incentives and we decide as a school what incentives we want to have, whether it be around diversification, whether growth, what kind of money do we want stored in our reserves? What are the things that we're going to do in this period to be financially sound? What are the things we have to put in place? And then, of course, filling key leadership positions is a big part of how I'm spending my time. Engaging with you. And this part is critical. Create community. That's part of what we do, part of our success, part of the reason why I created the position that Travis now holds, is creating community and expanding upon all the great things that we've done. Set priorities. And setting priorities has to be something that we do together and we agree on. We may not agree on everything perfectly all at once, but this is part of the exercise and where I need input. Strategic planning, as mentioned, you will all have the opportunity to participate in one way or other. Faculty, staff, students, alum, friends of the school will have a chance to inform strategic planning. Identity opportunities, starting really in a few weeks, where those surveys will go out. And then a call to be creative, which is what we have always done as a school. We need to do even more. Okay, so I'm showing these two. This is Colin and Matthew, my children at ages 2 and 5. And like a lot of parents, this is what I see at 22 and 25. These two incredibly cute boys, they got into everything. They were so much trouble. I cannot describe what it was like to be their mother. They were just into it all. So now I feel for every parent of naughty kids being able to go out and do this. And I know this sounds like a group therapy session, but I actually have a point here. So bear with me. Those two got into so much that I started off every parent-teacher conference with an apology. I just sat down, shook her hand, and started apologizing. I knew they had done something, gotten into something, whatever it was. And those conferences always ended the same way. I'd get this very prim teacher looking at me and a dire warning. You just wait. You just wait till they're teenagers. You're going to get it. You know, they're going to be something as they grow through that growth period. So after one particularly humiliating experience, I go home and I call my father. My dad was a World War II veteran, disciplined guy, and I'm going through all this. Clearly I've done something wrong as a parent. And he's laughing. He thinks it's hilarious. And I'm like, Dad, what's so funny? And he says, they're just like you. And so there we go. The parents' revenge is coming. Here's my point. This was as they grew up and did a number of things that were probably regrettable in their 15 to 20 year period. As a school, we're going to do some of those same things. The advantage of being the Colorado School of Public Health is that we're not the Harvard School of Public Health, and we don't have to do those things. The advantage of not being the oldest school of public health in the country is that we're not the oldest school of public health in the country. We can be Colorado, and I'm prepared to dust off all those apologies when I meet with Don. I know Don well enough. He's done a fair share of apologizing himself along the way. But I'm ready to dust those apologies off because we're going to do some things that might get us into trouble. And we're going to break some molds because that's our opportunity and that's who we are. And we're going to continue doing so. How we measure our success, because it really is all about us. I would like to see at the end of 5 years that we do have a very strong sense of the Colorado School of Public Health identity. Our mission, our vision, our values are driving our actions. That's where I want us to be. Continue to have a strong impact on the state by workforce development, the partnerships we create, and we should see improved health as part of what we do. Financially sound, increase base funding, and dare I say it, seek out a naming gift for the school. We have to be bold as we go forward. These are the aspirational things I'd like to see us get there, do. We may not get there, but we're for sure not getting there if we don't try. Growth in our research, support for our students. Student support is absolutely critical to one of the things I want to bolster. A cohesive, inclusive leadership team. It starts with us, and we're all leaders, and we need to have this feel. And last, further diversification of our faculty, our staff, and our students as a goal. So, thank you all for your time. Thank you for the opportunity to present vision going forward. For being able to follow John. Thank you. I appreciate that opportunity as well. It's your turn. So let's talk.
Sorry. Hi, thank you so much. I'm Emily Johnson. I am the Director of Policy Analysis with the Colorado Health Institute. And I was really interested earlier when you were talking about the growth that the schools have seen recently in research funding and how much of that is going to be part of the strategy going forward versus, like, I know we're in kind of a funny time with research funding, a lot of ARPA money coming through the state. So just sort of wanted to get a sense of what you saw that looking like in future years, or is that part of the diversification of funding?
It is part of the diversification of our portfolio. For those who don't know, I'm an economist by training and really do think of things as we have to be diversified. That with research, but gosh, we've done incredible. I think it's amazing that we've grown 17% over last year and we continue that trajectory. Now, whether it can continue forever or not, certainly there are going to be limitations, but that is an important part of what we need to do and focus on, as well as other sources foundations, being one of them, philanthropy being another, and all kinds of different creative ways that we're going to bring in. So support for researchers is going to increase here within our infrastructure. We'll do more recruitment, faculty recruitment. So we have some opportunities coming up and really focusing in those 3 areas in particular. And then partnerships so that we can create other new opportunities. Thank you.
Thank you, Donna DeBelia, Lead Center Director. So thank you, Cathy, for presenting this exciting, engaging vision. My question is also about research and this potential conflict, maybe that's not the right word, between, going after research funding that is driven by opportunity versus research that has impact and helps us accomplish the goals that you described in terms of improving health and, meaningful research. And it's hard to make sure that there is a balance here because a lot of funding for research comes from grants, and a lot of people, a lot of faculty member and a lot of staff and students are funded by these research grants to the extent that, they're afraid of losing funding because they won't survive. So what are your thoughts about trying to tilt that balance in favor of, meaningful research, innovating research, and not just research for the purpose of, paying salaries?
Yeah. Yep. So Donna hits on a really great point. 2/3 of our budget for the school is research dollars. 2/3. That's a lot. Yeah. And we depend heavily on those dollars to be able to sustain ourselves. And we really do think of it to some extent as hustling the next grant because we want to keep things going. And at that juncture, it can be quite difficult to venture out from what you know and what you know well, and you can have a really good shot. And grant mechanisms are set up so we don't necessarily take chances. They say they want us to be innovative, but they kind of don't, right? They want us to do something that's tried and true, and that's part of what we're judged against. I think we're going to have to think about these innovations. A school like UNC has the Gillings Innovation Fund, where they really do have the opportunity to stimulate and reward innovation through there. We're going to have to think about how it is we can do some of that on a smaller scale and make some investments. And as I said, there are things that we may do at this stage that are going to be taking some risk and doing things differently. But we do need to be able to try, certainly on a reasonable scale. 2 questions.
I had a really quick question. Sorry. So given what we know about the link between education and health outcomes, we've got this COVID cohort, right, of students who have lost 6 months of education. And I appreciate that we've got somebody who's externally focused and looking at partnerships. Where do you see us positioning ourselves so that we can support community partners and help them so that we can start planning for those future individuals who are going to have increased chronic diseases and a myriad of other issues related to that COVID cohort and that lost education? How can we do it better? How can we prepare? Because when I posed this question to healthcare administrators, they just kind of gave me a blank look. So I would love to see public health practitioners get in the forefront of this so that we're not caught off guard.
Travis, did you want to answer that? No, it's okay. No, that's a great question. It is a great question. I'm going to give you somewhat of a blank too, other than to say that what we have on our advantages are these existing partnerships that we can capitalize on and continue to grow and make better. And education, of course, is always a pillar of what it is that we do and one of our core values. We have these existing partnerships more so than some health administrators and health systems. Our reach is actually much broader, and to be able to work and to figure out how it is that we can address the concerns that you raise and to go forward. The good thing is we have the infrastructure in place. The disadvantage of we don't quite have that answer yet. But at least we, unlike some of these other organizations that you reference, have the infrastructure there to do some things.
Thank you so much for that thoughtful presentation. I enjoyed it. I was curious about your note about innovations and how we can start to leverage the innovations team on campus. And when I think of it, I think of like create a new drug and sell it. But like, what does that look like in a public health space? I'm just curious if you have some examples.
Yeah, it's interesting. So we have some good examples already within our school. Some of them, Sheena Bull's been incredibly successful within M Health and now is going off and developing her own business off of some of the things she's done. Of course, the Center for Total Worker Health and all the things that Lee Newman has done. He is certainly a very entrepreneurial person and has been able to be innovative. I recently had the opportunity to work on some things that I would have never in a million years thought of. I was doing, I still have an R1 to look at outcomes among individuals who are employed and caregivers of people with cancer. And I partnered with Mark Loudenslager, who was in the Department of Psychiatry. Mark passed away early in our grant from COVID. But Mark had developed an intervention that was, with other colleagues, some from School of Public Health, others from psychiatry, that was really all about counseling and providing support to that caregiver who's employed. Such a critical point. You're caring for someone with cancer. Cancer is incredibly expensive. Where do you get your health insurance through your employer? And you know, all of these things. So the caregiver is often being a caregiver and also trying to keep their job so everybody stays insured. And a big part of that is all the stress that then builds up on that individual. And so we thought about this project to apply some of the stuff that Mark's innovation, this intervention that he had developed, that we could angle it very much target to individuals in this situation, employed and caring and being a caregiver. Part of it is offered online. Part of it is coached with a counselor that goes through these very distinct sessions. And someone on the team said, you know what? There might be a market for this. This is targeted to employed people. What if employers could offer this to their employers as something, as just a benefit that they could offer them, a suite of benefits, kind of like we do Sleepio, right? Or wellness programs. This would be kind of cool if we showed, because so much of it's not evidence-based. We're doing a clinic randomized controlled trial. We have this 5-year R01. If we can show the evidence that this one works, this could be a benefit to employers. Maybe there's an opportunity to be able to market it. Cancer centers, comprehensive cancer centers, they may want to offer this to their patients as they now deal with these issues. Patients coming in, either they're working or their caregivers are. Maybe this is something that they can be able to offer it as well. So that by having that mechanism, as we started to think about it, as something that could push out the Colorado School of Public Health, push out what we've done, and have our impact be much more widespread than before. Thank you.
Hi, Sarah Lampy with Trailhead Institute. Hope everyone's doing well today. I really appreciate all of the audacious goals around the financial strength of the organization. I think the field of public health is moving towards quite a iceberg of a cliff that we are about to fall through with ARPA and other funding ending, as well as COVID response dollars. What strategies are you and the school going to implement to ensure that we are not competing for same dollars for the field, but actually growing the pie of funding for the field of public health so that we can all thrive together?
Yeah, great question. So part of this is the diversification of our portfolio. Actually, we don't compete as within our school. We do similar kinds of things. The collegial nature, people are really good about working together. And I'd like to see us to be able to do more and join forces so that we're even more competitive for these particular grant dollars that are out there. And then looking at that diversification across the portfolio. We have been, our culture is really around eat what you kill, right? To some extent, because we're thinking about survival. I think being coordinated, we become much stronger. much, much more stronger. We have our tri-campus model. We have our friends up at CSU. They are an important part of what they do. They expand the strength and the reach of our school. And that we need to tap into those resources as well, capitalize on one of our strengths, core strengths, and be able to work together and really do something across our tri-campus model. So up front, I'm getting a lot of this. So I think that means that is the last question we can take. I'd like to take a moment. Welcome, Chancellor Elliman. Thank you for coming. It's fantastic to have you. And I understand that you have a few things you'd like to say, so please come up.
Thank you for giving me a couple of minutes, and I'm going to make the first of what will be a number of different not announcements but events that will surround John's departure back to the faculty. I really wanted to publicly, because I haven't had an opportunity to do that, thank him for what he's done. You know, Cathy has something in common with John. Many of you may remember, so do I. We were classmates in high school. John and I perhaps didn't travel in exactly the same circles. I was more like Cathy's sons in the analogy. John was. I don't think John ever went to the principal's office for any particular reason. I did, but you did a fabulous job and really provided the foundation for what Cathy talked about for the future. So I really want to start by saying thank you very much for the service that you give. I mean, the school is a much stronger school today than it was when you came here, and for that we owe you an enormous debt of gratitude. So thank you. While I'm here, I want to take 1 second to endorse what Cathy had to say about the future. I hope you're having to come to my office and apologize. Only please don't apologize, because I want you to break molds. That's the only way. We're not ever going to have the resources that some of our private competitors or peers have. The way that our role in life is to push the envelope, in my view, to be innovative, to be agile, to take risks. And I think that applies to the School of Public Health as it does with all of our schools. And I'm thrilled that Cathy has the vision, and that you share that vision to move that philosophy through the Colorado School of Public Health, because there is an enormous need for what you do in all three aspects of your mission. There is such a need for it. And I will do everything I can to support Cathy going forward. And I thank John for all that he did to get us to this point. Thank you.
Thank you, Don. And thanks to all of you for coming today, and those online as well. It's been an absolute pleasure to be able to communicate this vision to you. And it's been, 78 days? That too has been a complete honor. And I look forward to day 79. So thank you all. Please join us for a reception outside. And it's been my pleasure. Thanks.